Illinois health officials recently issued a warning about surging COVID cases. More than 2,400 new cases were reported in the past day. That's far from the peak of 40,000 daily cases seen back in January. But you can see cases are rising over the past 30 days. Hospitalizations, though, and deaths remain low. But similar surges are being seen in many states across the country, driven by the subvariant known as BA.2. So joining us now to talk about the current state of the pandemic is Dr. Elizabeth McNally from Northwestern's Feinberg School of Medicine. Dr. McNally, I didn't think you would be back so soon. You were really the voice of reason for us all throughout the pandemic. Tell us right now, how worried should we be?
Well, I think we should still be reasonable. We don't love seeing a little uptick. I think we're all tired of COVID, and we would like to be completely done with it. And we're not talking about the massive tsunami that happened to us, right around the new year was when we really saw a big peak of it, and all through January. But we have seen a sort of steady, slight uptick over the last 3 weeks. And the 3,300 cases yesterday, I think, certainly did get some people to notice a little bit more. And so I think it's just keep a close eye on it and pay attention to it. I'm very hopeful we're not going to see sort of a real second peak like Europe has been experiencing. Our pattern looks very different from that.
Yeah.
So
let's talk about those numbers and how accurate they are, because a lot of people now are testing at home, and those aren't included in the numbers. Should we be required to give that test to someone to let people know so we have an accurate reading?
That's a really great point. I know that even though we saw all those cases in January, that's just a mere fraction of what people were experiencing. I know when I talked to my patients and family and friends, so many people didn't tell their doctors about it. They tested positive and they were feeling okay, so they let it go. But if you do have significant comorbidities or you're older, you definitely do want to tell your doctor, because the difference now is that we have treatment options. And so you may be eligible for some of those. It's a quick 5-day course of some medications, and it really can protect people who are at higher risk. So it's worth talking to your doctor, especially if you do have, you're older, you have comorbidities.
Right. There are so many other things going around right now, different flus and things like that. So what if you test negative at home? At what point should we absolutely go get a PCR test?
Well, the overall view on this is that most people, if you've been vaccinated, if you've been boosted, you may have no symptoms at all. You may have a mild cold. A few people may be a little bit achy. The kids all took their masks off in school. So now we're back to the usual of kids sharing things in schools and bringing that home. So there's lots of RSV running around. There's some terrible norovirus running around as well, giving lots of people GI distress. I think, it really depends. Again, if you're not vaccinated, then for sure you want to take this seriously and you want to get in and get tested, because we have lots of treatment options now. But if you're feeling better pretty quickly, your test, I think you just got to maybe discuss it with your physician and decide. Lower risk people, that may not be necessary to do at this point.
You brought up the boosters. Many people have gotten their boosters. So the question is, when do we really need a second one? I know there's some controversial studies out there about if you get the booster too soon, then it may not help you develop the immunity that you want. So what should we be doing with regard to boosters?
Yeah, so boosters, most people hopefully got what we're calling the third shot, so the first booster. I know I got mine as soon as I was eligible to do it. I went out and got it. But now we're eligible, if you're 4 months or beyond and over the age of 50, you're eligible to get what would be your fourth shot of these. And there's very little harm in doing that. Certainly if it's been 4 months, your antibodies have probably dwindled, and so it's a reasonable thing to go out and get a booster, especially if we're seeing this little uptick right now and you're out and about. That's just an added layer of protection that you can have for yourself. I find the interesting part is so many people were exposed in January that in many ways that acted like a booster for a lot of people. And so for some people that may have been the equivalent of that fourth exposure or third exposure, depending where you were in your booster cycle. We saw lots of people's antibodies go way up in January. So.
All right, Dr. McNally, thank you so much. I have about 5 more questions that I could ask you, but we're out of time here. We do appreciate your help in helping us to sort of put it all in perspective and figure out what we should be doing right now. Thank you for your time.
All right, take care all.
Ray?